Welcome everybody to the Washoe County District Board of Health. Are we there? I guess we're here. I want to call the meeting to order. We've got a good agenda today and a few other things and a couple special things to do today. So welcome. We're there. Okay. First thing on the agenda, would you call the roll, please?
Yes, sir. Chair Novak.
Here.
Mike Brown.
Here.
Oscar Delgado is absent. Christopher Dare is absent. Dr. Danko. Here. Marsha Burkbigler. Here. Tom Young is absent, and we have a quorum.
We have a quorum. Good. Thank you very much. Pledge of allegiance. Chief Brown, would you lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Madam Secretary, do we have any public comment?
Not at this time, sir.
Good, thank you. Moving right along. We have an agenda sent to us. Do we have any changes in the agenda?
Second.
All in favor? Aye. Aye, thank you very much. Okay, now comes a really special part for today. We have, under recognition, Mr. Uberry, would you like to make a statement, please?
Thank you, Chairman Novak, members of the board. In a few minutes, you will be recognizing my friend and associate, Dr. Lei Chen, who's now retiring. But first, I'd like to read this statement into the record. Rarely do people have the opportunity to know intimately or work closely with someone whose talent and accomplishments have impacted them not only personally, but also others, locally, regionally, nationally, and internationally. Such is the person of Dr. Lei Chen. Those of us who have had the opportunity to work with her have witnessed her epidemiological skills during investigations and interactions with officials at the highest level, including the Centers for Disease Control and Prevention. Lei is known for her no-nonsense approach, not only to disease and outbreak investigations, but also in incident command and meeting management, which has earned her the affectionate nickname General Chen. Lei has always been willing and eager to work the extra time it took to lead investigations and also volunteer time to help in other projects after hours and on weekends, like the recent Casper survey. She always took the time to explain highly technical information for consumption by her public information officer and the general public. Her intellect and dedication, along with her humor and temperament, make for a personality mix that endears her to everyone, and it will be sorely missed. I could go on and on with stories of how she has epitomized the health district's mission of protecting and enhancing the quality of life for citizens of Washoe County, but that would fall short of describing the full appreciation that many of us here at Washoe County have for Dr. Lei Chen. In closing, it is my pleasure and honor to work with you, Dr. Chen. On behalf of myself and many, many others, I thank you for your hard work and friendship and wish you the best in your retirement.
Thank you, and we'll make that part of our permanent record. Thank you very much. Mr. Health Officer. Mr. Acting Health Officer.
Yes, Mr. Acting. I think the light is on. Good afternoon, Mr. Chair, members of the Board of Health. Steve Cutts, acting for Kevin Dick, our Health Officer. So our recognitions this afternoon, as Mr. Uleberry just read into the record, we are recognizing Dr. Lei Chen, who has over 17 years of time with the Health District. I would just like to comment that I had the excellent fortune, one of my best days here at the Health District, in hiring Dr. Lei Chen over 17 years ago. She has been phenomenal. She has been a huge asset to not only us at the Health District, but also within the community and well, internationally now. So we will miss her greatly, and it is a big loss for us as well as our community. So we want to thank you for your time with us. And we have a clock that I will issue you, I think, after I go through all the recognitions. I'm a little new at this, so pardon me. But so congratulations to Dr. Lei Chen. All right, moving on to years of service, we have Ms. Lori Mendoza. Lori is celebrating 25 years with Washoe County, and she was hired in March of 1994. So congratulations, Lori, and we have some nice hardware, as Kevin would call it, 25-year pin that you will get when we do pictures here shortly after. Nancy Kearns Cummins. Nancy has 20 years of service with Washoe County. I've had the good fortune of working with Nancy since almost the entire time when she was hired in 1999. So congratulations, Nancy. And we have Mr. Steve Fisher, who is celebrating 15 years of service with Washoe County, all with the Health District, I believe, yes? Yes. So Steve is our department systems specialist, and we are thrilled with everybody here and their time of service with us, so thank you, and we'll do pictures shortly in a couple of moments. Moving on to new hires, we have Ms. Rachel Cord, who is going to be introduced by her supervisor, Ms. Jennifer Pierce, I believe, that's what I was told. Come on down.
Both of you.
Yes.
Jennifer Pierce, Fiscal Compliance Officer, Administrative Health. I'm super excited that Rachel is the newest member of our team. She comes from the state, and she's going to be a great asset. She has accounting knowledge, grant experience, HR experience. She even has experience in medical billing.
Ooh.
So,
Ooh.
yeah. So we're super excited to have her join our team. We're going to have a great fiscal team in administrative health. So
Would you like to
Rachel-
take over my chair spot?
No, not by the
Thank
So-
you. We'll be
Welcome,
back
Rachel.
with pictures in just a minute.
Wonderful.
Thank you.
Thank you.
Meet you all.
All right, moving on. We have Christabel Sotelo Zacina? Okay, sorry. I should have probably checked with Kim or Chad before this. And Kim Franchi, Environmental Health Supervisor, is going to introduce her.
Thank you, Chairman and members of the board. For the record, Kim Franchi with the Vector-Borne Disease Program. Our newest employee here is Christabel Sotelo. Zasenia.
Thank you.
Christabel comes from the State Health Department as well, with about 3 years of experience and a background in epidemiology. Her interests are hiking, hanging out with her friends, and trying out new restaurants. But wait a minute, that may have changed since she's been training in the food program. She's going to be a great asset to environmental health as she's going through the programs, and we're very, very proud to have her.
Good. Welcome aboard.
Thank you.
Welcome. All right, and the final person to be introduced, I will do, as Division Director for Community and Clinical Health Services. So Sunwa, if you want to come up to the podium, and I'm just going to stay here. Okay. All right, that's okay. All right, so CCHS would like to welcome Sunwa Lee to the Health District. Sunwa has a robust background in public health, having earned her Master of Science degree in epidemiology from UCLA, and Master of Public Health from Seoul National University, and having worked as a research scientist for the Salk Institute for Biological Studies, as well as a technical consultant. She also volunteers in our community, currently serving as a member of the Washoe County School District's Gifted and Talented Advisory Panel. Sunwa will be working on projects addressing the misuse of opioids and other prescription drugs in Washoe County. She will especially focus on relationship building between all the organizations addressing the opioid crisis in Washoe County and promoting alternative pain management therapy. So we're very excited to have Sunwa with us, and please join me in welcoming her to the Health District.
Welcome. Thank you.
All right. And now we have 2 recognitions for Shining Star people. We have Viriana Chaidez Mendoza, if you want to stand up and be recognized, as well as Ms. Lenny Shore. Both of these ladies are being recognized today for having 3 shining stars. So thank you, ladies, for the excellent service you provide our customers. Okay, and with that, we're going to do pictures, so everybody's,
Before we go down to
Oh,
pictures,
yes. Oh, okay.
I just want to make a
All right.
statement. I was lucky enough to be invited to a showing of a picture that was filmed because of our discovery with Dr. Todd and Dr. Chen about bacterial resistance and drugs, and it's becoming a huge issue around the world. It's not just here. And a German company came and filmed this. Hopefully, we'll be able to see it, and make it public sometime in the next couple months. And it was just absolutely terrific. Steve, thank you for doing an editing job to make it a little bit shorter, but to find out what kind of health department we have here and the people we have working for us is absolutely incredible. And one of these days, it's going to be able to be shown, in public. But this is just an amazing piece, and hopefully the board and our whole health department can see it a little sooner than later. So, thank you very much. And everybody, come on down, and we'll take some pictures. They're for you. Center stage, please. Those are for you too. Thank you so much for everything. We're gonna miss you. And as soon as our restaurants are checked out, we'll let you know.
Okay, on three. 1, 2, 3. And one more. 1, 2, 3. And wait, one more to send you some. 2, 3. Thank you.
Thank you so much. Thank you.
Good job.
I have the privilege to hug everybody.
all right, so
No,
next,
Bill.
is there, would we like to do years of service?
Great color today, too.
Yes.
I totally approve.
50
Remember, you
years
built
with
this shirt
Mr.
when you're done.
Fisher.
Good job, Steve.
Harvard, you do not get a certificate. Or maybe you do. If you do.
He does.
On three, please. 1, 2, 3. And one more. 1, 2, 3. Good. Thank you.
Thank you.
Congratulations, Mr. Fisher.
And welcome for another 15.
How about Nancy? 20 years.
Boy, you have been really great over your career. And see what?
Okay, on three. 1, 2, 3. And one more. 1, 2, 3. Good. Thank you. All right.
Congratulations. All right, Ms. Lori Mendoza, 25 years.
Oh. Yeah, I'm happy to have that.
Thank you so much.
Okay, on three. 1, 2, 3. And 1, 2, 3. Good. Thank you.
Thank you very much.
And then I believe we have both Shining Star recipients come up at the same time. So Bee and Lenny, come on up and we'll get a picture with you two. Oh, and we have Shining Star poster. Here you are. Yeah.
That's a good idea. Thank you.
Okay. On three.
you so much.
Thank you very much.
You can't retire yet.
You would, no, you got a picture right now.
Okay, cool. Yeah, there you go.
Tighten up, please. One, two, three. And one more. One, two, three. Great, okay.
Welcome to the club.
All right. Okay, oh, tassels, okay. One, two, three. And one more. One, two, three. Got it. All right.
Welcome.
Hi, thank you.
Nice to meet you. Nice to see you again.
Yeah, we're glad to be here.
Yes, nice to meet you. For everyone knows it's here.
All right, someone, come on up.
So I know you just started at CCHS, but you're never gonna have promotions yet.
Some big shoes.
One, two, three. And last one. One, two, oh. One, two, three. Good. Thank you.
All right.
Thank you.
Okay.
Welcome.
Now
Thank you. So far, so good. Okay, now that all the fun's done, let's move down on to the work. Next item number 6 is the consent agenda. Does anybody want to pull anything talked about? I'll take a motion.
Motion.
Rick Brown, we have a motion by Chief Brown, Council, or Commissioner Burke Bigler is a second, so all in favor?
Aye.
Opposed? Carries. Moving right along. Now we have an update and possible direction to the staff regarding the Reno Fire Department EMS response. Christina Conti, please.
Hi,
Hi.
I have no update. Questions?
No,
My
I
staff report
understand the
stands.
meeting was moved, or, so, thank you for your report. Yes, ma'am.
Question. So when is Reno going to submit the report?
I have no idea.
Okay. Just
I'll defer to
get
Chief
it on the
Cochran if
record
you'd
that
like
they
to come
need
down.
to, they need to step up to the plate and submit the report. Oh, there's my favorite, Chief Cochran. Thank you.
Or was.
Thank you for that. Dave Cochran, Reno Fire Chief. So a little background, we've had some challenges over the years about what we report, how we report it, and those challenges continue today. And then we made some changes to our system, which added a technological challenge, and that's what we've been wrestling with. And over this time, approximately the past year, we have been working with a consultant because we're a data-driven world, right? And we're trying to get better at that. And we're really taking a hard look, a critical look at what we have been doing. And I'm talking about the Reno Fire Department, not the EMS Oversight Committee necessarily. I don't want to say we're doing it wrong, but I'm looking at it and I'm really looking at it and thinking we can and should be doing something different. And so we've hired that consultant's been here literally all week. We brought him in on our dime. He's been here all week. He's teaching, he's educating us. He's teaching some reporting classes for us. And I need a little time to digest what he's recommending. And I'll give you an example of one of the things that really caught my attention. So we just report generic response times. This is our average response time. It's 6 minutes, it's 7 minutes, whatever it is. Well, if engine 1 on A shift goes to 10 calls, and they go to 1 each hour, and they come back, and that day, those 10 calls average 6 minutes of response. The next day, engine one B shift goes to 10 calls, but 5 of them are back-to-back, and 2 of them are at the same address. So they have response times that are 15 seconds sometimes. That's not a valid comparison, because engine 1 on B shift is gonna have a 2-minute response time average, and of course, that's a microcosm, but over the course of time, that does have an effect. We really wanna look at what are we measuring and why are we measuring it? Do we measure, and spoiler alert, yes, we do. We measure from quarters to the call, and then compare that from quarters to the call. So those are the kind of things that we're looking at in terms of our responses and what we're gonna report. And we are really, in a long-term sense, driving toward accreditation. And so I wanna make sure that these changes that we're gonna make are going to reconcile with what the EMS Oversight Committee is looking at, so that we're not putting contradictory data out there. So, long way of saying, need a little time to digest it. Then I can connect with Christina and her team, educate them, and I mean that in a positive sense, on what we're looking at as far as reporting, and see how we can reconcile that with the data.
Chief, do we have
Thank you.
any idea of when we're going to start getting at least some data to the MS committee? Because it's been, what, 6-8 months now, and I understand what you're trying to do, and I really appreciate it, but we're also holding up the whole committee's.
And, I don't want to overpromise, and I don't want to, and I think we would all, well, I can't speak for you, but I don't want to be expedient to say at the expense of good data, good reporting. So like I said, the consultant will be here through tomorrow, and hopefully, within a couple of weeks, we'll be able to really look at what, I haven't been in all these meetings, so I'm not sure what he's going to leave us with in terms of reporting templates, if you will. So hopefully next week or within a couple of weeks, we'll have our template in place, be able to really demonstrate what we plan on doing, and then reconcile that. And I think really, in terms of providing the data, that's going to be pretty quick. That's going to be within, prior to your next meeting, in all likelihood.
Okay.
But reconciling that with reporting for the EMS oversight as opposed to, or in conjunction with what we're reporting, is what I'm concerned about.
Well, I understand that, and I think Ms. Connie does too, but, if we can get something someplace that we can start to work towards a kind of common goal again. And I understand what you're trying to do from your standpoint. It's your department, and I want data that's going to work for me. So, and if we can get some of that, and we can help, I'm going to commit you a little bit to take some of that data and kind of put it into a format that can work for all of us. So I appreciate
I'm very excited about what we're doing, because it's department-wide. It's not just EMS, but of course EMS.
No, I understand that.
Part of what we do.
Yeah, I understand that. Any other questions? Yes, ma'am.
I just want to thank you very much. I'm glad to hear that you're working on putting the plan together so that it's logical to you, which will make it, I'm sure, probably with a little tweaking, logical to me. So your brain works much better on these issues than mine. But I also want to take this opportunity to say that I was with a friend who slipped and fell outside of Simon's, and she hit her head and ended up in the hospital because of it. But the Reno Fire Department came, they were fabulous. Also, RIMSA came and transported her, and they were fabulous. But I do want to just tell you, Chief, what a great job your guys did. And to their credit, they knew that I was a county commissioner, and they were still wonderful.
I told you, you're our favorite. So I
Anyway.
appreciate those kind words, and I'll be back next month, and hopefully, well, I'll give you an update. I don't want to overpromise, but I think we're moving in a really positive direction that I think the region's going to be able to benefit from.
Good. Thanks, Chief.
And so just to clarify, the goal is to get the numbers to Washoe staff so they can in turn take it to the EMS advisory board, in turn to get a report generated for us as well. And then as far as putting all the numbers together and everything that goes along with that, you may have a new way, potentially. Okay, that's good to hear. And then, once they go to the EMS advisory board, which you have a member that sits on that board, your city manager, correct? And she's up to speed and up to date on everything that's taking place, I'm sure, right?
Yep.
And then, as far as the board goes with what the outcomes, it's all advisory. So who knows? We may get new advice on where we're going to be able to use those numbers. And that's what, I think I'm looking forward to, especially you've got a new way of doing things.
Yeah.
So it'll be interesting to see the report when it comes out. So
Good.
thank you.
Very good.
Thank you, Chief.
Okay, thank you.
Good? Okay. Thank you. Okay. Do we need to acknowledge the report?
Mr. Chair, it's for possible
Okay, good. Well, thank you, Chief. Thank you, Ms. Conte. Moving right along to the Regional Emergency Medical Services Authority. Mr. Dowell will bring some help with him today.
Good afternoon, Mr. Chairman and Board. My name is Dean Dow. I'm President and CEO of REMSA and CareFlight for the record. In front of you, I believe you have received a copy of your February compliance report for review, and I'm available for any questions if you have any.
Any questions, comments? Okay,
I'll move to accept the report as presented by Mr. Dow.
a motion? Second, okay, we have a motion and a second. All in favor?
Aye.
Opposed? Good, we accept the report. Thank you very much.
Thank you very much. You have a
I
good
do
day.
want to mention, I read through all the comments from the EMS. That's probably the best list of comments or non-comments that we've had in a long time, so I'm sure they appreciated
Yeah,
that.
they do.
So.
Thank you.
Good afternoon, Mr. Chair. My name is Alexia Jobson, Public Affairs Manager for REMSA for the record. You should have in front of you also the February Public Relations Report for review. So today I'll give you a little bit of an update about some of our more current activities. Earlier this month, REMSA's partnership with the Washoe County Sheriff's Office Hasty Team received media coverage focusing on the topic of avalanche safety and preparedness. It was covered by all 3 local networks. In addition, REMSA hosted a press conference on behalf of Flirty and the City of Reno to announce that the partnership program that we have with them has been approved by the FAA to have drones fly past the line of sight as the next step toward AED drone delivery. The event received extensive coverage locally and on news outlets across the country. It was a successful event, and we are excited about advancing the program together from this point. And finally, REMSA's Center for Pre-Hospital Education continues to offer bleeding control classes. Our March 27th class was featured on the local CBS and NBC affiliates. I'm happy to answer any questions that you might have.
Questions? Comments? Nice report. Thank you.
Thank you.
Okay. Next, number 9, regarding draft bills and requests from the legislature. Mr. Acting Health Officer.
Okay. Sure. Steve Cutts for the record, filling in for Mr. Kevin Dick. So Ms. Rogers handed out the legislative summary that you all have in front of you. It's an extensive spreadsheet, many pages. So those are the bills that the Health District is tracking. But Mr. Dick and Ms. Joelle Gutman, who is our Government Affairs Liaison, provided me with some updates, so I wanted to give you a few highlights, if I may. So SB 263, that bill is being heard, well, in 2 minutes at 1:30 today. So this bill provides for the licensing of wholesalers and retailers of e-cigarette products and taxing e-cigarettes and vaping devices as other tobacco products. This is a tax rate of 30% of wholesale price under existing statute. And what this bill does is proposes to provide 80% of the tax revenue to health authorities distributed in proportion to population to address public health priorities. So what Mr. Dick is proposing is to provide 20% of that revenue to tobacco prevention efforts. This bill addresses the board's priorities of increased state funding for public health and improved e-cigarette and vaping regulation. AB 66, that is being heard tomorrow. That is it establishes the Washoe Regional Behavioral Health Policy Board bill to establish the crisis stabilization centers. Models are operating with great success in other states. Amendments are proposed that would allow for licensing as short-term psychiatric hospitals so that Medicaid and Medicare reimbursement for services would provide financial viability for these facilities. SB 448 was heard on March 26th. That provides for transferable tax credits for affordable housing to be issued at the level of $10 million per fiscal year until June 30th of 2023. AB 270 was heard on March 25th. It's the Nevada Crisis Response System. It requires Department of Health and Human Services to establish the Nevada Crisis Response System to coordinate with social service agencies, local governments, nonprofit organizations, to identify, assess, refer, and connect persons who are transient, at imminent risk of homelessness, or homeless to housing, assistance, and services. Provide and operate a system for responding to a crisis that is accessible by such persons 24 hours a day, 7 days a week. And provide education or information on how such persons may access and use the system for responding to a crisis. It is intended to help prevent and address homelessness in the state. AB 231 is in working session this afternoon. This bill would have excluded all vehicles manufactured before 1996 from the smog check program. After meeting with Ms. Albee and Ms. Gutman, the bill sponsor removed this and all provisions from the bill which would have negatively impacted air quality. And Ms. Albee is not here this afternoon. We have Mr. Mike Wolf, who will cover her portion, but she is at the legislature this afternoon regarding this bill. AB 169 is a bill that was heard on March 22nd, and it establishes a maternal mortality review board. We supported this bill and offered information about the establishment of our own fetal infant mortality review board that happened many years ago. We highlighted a number of things, some of them including the data collected that has benefited all of Nevada, and it helped establish the Go Before You Show outreach campaign. SB 448 was heard on March 26th, and this has to do with affordable housing. It is being sponsored by Committee Chair Julia Ratty and Vice Chair Tyrone Thompson. The bill provides for the issuance of transferable tax credits to a project for the acquisition, development, construction, improvement, expansion, reconstruction, or rehabilitation of low-income housing. This bill has received an immense amount of support, and notably J.D. Klippenstein, the executive director from Action, gave great testimony on his organization's behalf. And the volunteers swarmed the building, as Ms. Gutman said, all day advocating for the homeless, so it's had great support. On March 26th, the bill AB 174 was heard, and that establishes the Nevada Interagency Advisory Council on Homelessness to Housing. So there are a number of bills that are speaking to housing and homelessness. And that is the report from Mr. Dick.
And for those, Mr. Dick is down testifying this afternoon, so we've got a very capable fill-in today. And moving right along to staff reports. And we need to take action on that one? Just accept the report?
Oh.
Okay, well.
So
take a motion.
I would request that you approve the report as presented.
We'll do that. You have a motion? Yes, motion. Okay, have a second? Okay, good. We have a first and second. Commissioner Burke-Bickler and the doctor. Renico is first and second. All in favor? Aye. Opposed? Accepted. Thank you. Okay, now we get down to another one of our substitutes that are very capable of doing this. So.
Mike Wolf, for the record, filling in for Charlene Albee. I have nothing to add to the staff report, but would be happy to take any of your questions.
Good. Any questions? Good. Thank you very much. And are you going to give your report today?
I am, yes.
Okay.
Steve Cutts, for the record, Division Director for Community and Clinical Health Services. I have nothing to add to my report, but would be happy to answer any questions you may have.
Thank you. Questions? Okay. Okay, Mr. Westham.
Yes, hi, Chad Westham, EHS Division Director. I don't have anything to add to my report, but I'm happy to take any of your questions.
Good. Questions? No? Okay. And our next, boy, this is substitute day.
Yeah.
Aren't you lucky?
I am very lucky, thank you.
Christina Conti, for the record, I'm standing in for Dr. Todd. If you have any questions that I can write down for him, I am happy to. Otherwise, we are going to defer our time to Ms. Heather Kerwin, who facilitated the Casper for our region. We told you about it last month. It is now concluded, and so she's here to present some information on it.
Good, terrific.
Heather Kerwin, EMS Oversight Statistician. Just to give you a brief update on Casper, if you're not familiar with it, we're the fourth jurisdiction to have conducted a Casper in Nevada. We are not the last state to have conducted a Casper, so we're winning so far. It's Casper, for those of you who are not familiar, is a CDC mechanism that was developed really to evaluate either before an emergency, during emergency, or after emergency, how the community is doing on a household level. So it's a two-stage sampling design, and I'll stay out of the statistics weeds for now. But it really makes sure that the data that is collected through this survey, it's a door-to-door survey, are generalizable back to the total population. So we included all of Washoe County as our sample population, as our initial sample frame. And we had, during the week of March 12th through the 17th, we had 37 volunteers go out into the community over the course of 6 different shifts for 4 different days, and we collected 224 surveys, and I'm proud to say that that was a 94% response rate, and that's the highest of the 4 jurisdictions who have completed a Casper in Nevada so far. So I'm really proud of our volunteers. I've just finished analyzing the data. We're going to develop a more comprehensive report, and at that time, bring that back to both the board and the greater community so that we can be better informed of how to better prepare our community and our residents in the event of evacuation, natural disaster, or otherwise. I'm happy to answer any questions you might have at this time.
Thank you. Question? Good. Thank you very much. I know this is a lot of work. Thank you.
You're welcome.
I'll just end with a reminder about Dr. Chen. With tomorrow being her last day at 2:30, we're having cake for her. If any of you, today. If any of you would like to attend.
Any other?
Yes, at the Health District.
Good. Thank you very much. Okay, it comes down to our acting health officer.
So Mr. Dick provided me with his report, which I went over. He told me I don't have to read it, which is great because there was a lot of information in here. But it is included in your packets, and if there are any questions that, to borrow from Ms. Conte, that I may be able to write down for Mr. Dick to answer in the future, I'd be happy to, or if I, of course, could answer a question, I would give it my best try.
Well, thank you. Nice report.
Oh, well,
Okay.
we will be sure to let him know that.
Okay, board comments. Commissioner? Nothing? Nothing?
Doing a good job.
Wow.
Wow, this is like a
Well,
record.
I want to thank everybody for being here. All of us that are just substituting for somebody else did a tremendous job, and if you look at the clock, this is the best meeting we've had in a long time. And Commissioner Berkbigler would like to have her meetings go this long. Couple things. Our new report's out for the year, so look forward to that. And I do want to mention that on the dais, I put something out of today's paper that is for all of you to find at your own, mailbox or whatever. It's a deal from California on toughening the immunization laws on measles. And I know that you have probably seen enough on TV to last you a lifetime, but unfortunately, you probably haven't seen the tip of the iceberg yet. Measles, if you're exposed to it, is so contagious, 90% of the people that are exposed are going to come down to the measles. The older generation, we've got to jump on them because most of us had the measles at one point. The younger generation's not, and it's a terrible public health problem. It is in the United States Congress already because on my trip to DC to represent NALBO, which is the local association of local health boards, we met with NACHO, which is our equivalent National Organization for Health Officers. We did a Hill Day and got a tremendous response. And I do have to commend our 2 U.S. senators, and the people they sent to meet with us were their top staff people. We just didn't have a photo op. We had a real meeting. I have gotten about 10 emails in the last 2 days from the 2 offices looking for more information about Nevada and Washoe County in particular and what we're doing. So it was an extremely worthwhile trip all the way around. And the measles outbreak is very much on everybody's, hot burner right now. So Anything else anybody wants to bring up? Okay, I will take a motion. Oh, public comment. I'm sorry, public comment. There isn't any public comment. Okay, it is now 1:40. Do we have a motion?
Yes.
Okay. Yeah, what she said. Anybody wants to second that? Good. We're done. Thank you very much.